Well, we're going to learn more about some help for children. We have got Dr. Jill Emerick with us. She's with Pediatric Endocrinologist, and to tell us more about what you're doing at St. Rita. So thanks for coming today.
Yeah, thanks so much for having me.
Okay, so you can provide different services for children in your practice, and some of these are to do with hormones and really important issues, right?
Yeah, so what a pediatric endocrinologist does, I mean, just to give you a little background, so I was a general pediatrician first for about 4 years, and then I did 3 years of extra training in pediatric endocrinology. And so as a pediatric endocrinologist, I take care of children, you know, birth through college-age kids and anyone that has, you know, hormone-related disease. So
what is the most common thing that you see then and deal with?
Yeah, probably some of the more common diseases that we see are type 1 diabetes is a big one. So also thyroid disease in kids, that's another one that we see commonly. And then any concerns with growth and puberty, that probably makes up about 75% of the practice. And then there's probably some rare hormone conditions, whether it's pituitary related or adrenal gland related, or some genetic diseases that have, you know, endocrine issues as part of it. That's probably the other things we take care of as well.
So how would a parent know that maybe they need help from you, or does their pediatric doctor catch these kind of things and send your way?
I would say usually it's you're seeing your pediatrician or your family practice doc or your nurse practitioner, and that might be something that, you know, gets diagnosed in their office, or, you know, sometimes kids with new onset type 1 diabetes, they might end up in the emergency room first and then come to see the pediatric endocrinologist. But I think, you know, for parents in general, if you have concerns, bring that up with your primary care doc. And I think I've been getting to know a lot of the doctors in the area, so hopefully they know that there's this resource available now, and we can definitely help take care of all those things.
Mm-hmm. Before we were on, you said you were a doctor of hormones. Well, what do parents look for then to know that maybe the hormones or things aren't going right the way they think?
Yeah, so I think thinking about some of the most common things that we see, so growth is probably a big one that's easy for parents to track. So obviously people come in different shapes and sizes, but whenever you go to your doctor's office and they look at your growth chart with you, you know, if your height gain or how you're growing for height is, you know, you're moving curves, you know, you're falling off your growth curve, that would definitely be something that, you know, pediatric endocrinology might come into the mix. Or things like, you know, diabetes being another common one. So, you know, feeling thirsty all the time, frequent urination, you know, those would be kind of your most common symptoms of maybe thinking about something like that.
These issues you've been talking about, they sound like big challenges, but should parents know that, hey, you're here, you can help and work through some of these issues?
Yeah, I think that's one of the best things about being a pediatrician is, like, our patients usually have a lot of reserve. They're pretty healthy to start with. So yeah, I think we can help. They have a really nice setup over there at St. Rita's with, you know, going back to the type 1 diabetes population. You know, they've already kind of got things set up to download insulin pumps and look at continuous glucose monitors and really keep up with a lot of the technology that we've been able to provide to our patients so far. And yeah, you know, chronic disease in kids can be daunting, but I mean, I feel like that's one of my favorite parts of my job is, like, being able to provide that education piece and help families figure out how that they can make the disease part of their life and not have to be something that they have to live their life around.
Right, yeah. Yeah, so you can tell you have a passion for it, and so I think that probably makes parents too, or guardians, feel better knowing that you're there for their child.
Yeah, I mean, yeah, being a pediatrician, or, you know, just getting to take care of kids, it is I think, a privilege to really be part of a family's life and help them figure out how to navigate those things.
All right, and so you're in town now to help navigate through these issues. Thank you very much for coming today and sharing with us.
Yeah, thanks so much for having me.
All right, don't go away. New Tradition continues in a moment.
Welcome, Ohio, to our Black